I'm a big promoter of second opinions. So I think any cancer diagnosis, especially, sometimes does warrant that type of conversation. But specific to stage, I think when patients have an advanced cancer, and they're noting either progression on chemotherapy, it's important to have those conversations about other treatments. Ideally, we would like to be involved, meaning surgeons and surgical oncologists that specifically do this. We would like to be involved at the beginning because, again, we do have an idea of how much disease there is and ultimately what needs to be considered to make sure someone can go through a procedure, or if they ultimately have unresectable disease, meaning that it can't be removed with surgery, that's a decision where we can have a conversation with the medical oncologist giving the IV chemotherapy so that they can plan definitively. A lot of the imaging sometimes does underestimate the amount of disease that's present within the abdomen. So I think it's also important to have that conversation up front and make sure that patients have a very thorough evaluation and the expectations are outlined, because especially with regards to surgery, and I'm sure we'll touch on the risks of the procedure, but it is a combination of multiple surgical procedures in one. So whereas you can have a portion of the bowel removed, the spleen removed, portions of the liver removed, it does combine multiple procedures to, again, effectively try to treat this. But the bottom line is that when patients are evaluated and they are deemed to be candidates, we know that Hipec will increase survival time significantly.